I celebrated my 33rd birthday in the chemo chair. So my mom had brought some cupcakes over, and she had talked to one of the volunteers before and said, if I bring something over, can we have a little celebration? So I remember one of the volunteers, and I can't remember her name, but she tried to make that day special for me, but also special for some of the people there that were getting treatment. So we had cupcakes and celebrated my 33rd birthday. I never feel when I'm here for an appointment that I'm being rushed. I always feel that I can ask any question to either my oncologist or some of the nursing staff helping out with things. And I definitely feel that you're looked at as a person as opposed to just, patient number 1, 2, 3. People want to know about you, they care about you, they care about your life outside of your cancer journey, so they do really look at you as a person and want to make sure that you're able to move on from your experience. When I first was diagnosed, I had no idea that they even administered chemotherapy in Sound, so that was a real eye-opener for me. I had to go through some radiation treatment in London, so experienced not living at home for 2 months, which really made getting chemo in Sound that much more of a positive experience. Being able to drive, 45 minutes to get your treatment and go back home and still be around your family and friends and not have that much of your life disrupted, it's a really important thing. We're very fortunate to have a local hospital that does administer chemotherapy for people. I think it's really important for my demographic to support our local healthcare, our local hospitals, our local communities. You never know when you may be the one that needs some of the care that's offered in our local healthcare facilities. It's not something that a lot of young people, I think, in our community are out there talking about, but it is something that, people need to be aware of what we do have around here, but also how they can continue to contribute and help ensure that we're keeping our facilities up to date, we're attracting and retaining the right staff. We've got the best medical equipment and facilities that we have for people, because you never know when you may be the one who needs to use it. I hope to never have to use the oncology facilities at Owen Sound ever again. However, I would like to be part of something that will improve the experience for people who do need to use it in the future. It is a daunting experience walking into that room for the first time, not having any idea what you're getting yourself into.